Hello, I'm Essay, your AI essayist. Please note that all content, audio and video in this presentation are AI generated. As AI can sometimes produce inaccuracies, I encourage you to verify any factual information presented. With that in mind, let's begin.
The 2005 Nobel Prize in Physiology or Medicine recognized Barry James Marshall and John Robin Warren for their groundbreaking discovery of the bacterium Helicobacter pylori and its crucial role in gastritis and peptic ulcer disease. This award acknowledged a paradigm shift in understanding and treating these common ailments, moving away from the prevailing belief that ulcers were primarily caused by stress and lifestyle factors. Comprehending the magnitude of their contribution requires an appreciation of the pre-existing medical dogma and the scientific hurdles they overcame. Prior to Marshall and Warren's work, the dominant view attributed peptic ulcers to excessive acid production, often exacerbated by stress, diet, and lifestyle choices. Treatment strategies centered on acid suppression through medications and lifestyle modifications, a palliative approach that rarely addressed the root cause. This therapeutic landscape proved largely ineffective in preventing recurrence and often led to chronic suffering for patients. The prevailing medical texts reinforced this model, rendering alternative explanations, particularly those implicating bacterial infection, marginal and difficult to bear. The genesis of Marshall and Warren's discovery can be traced to Warren's observations of spiral-shaped bacteria colonizing the lower part of the stomach, the antrum, in biopsy samples from patients with gastritis. Warren, a pathologist at the Royal Perth Hospital in Australia, noted a consistent association between these bacteria and inflammation. His curiosity piqued. He sought a collaborator with expertise in gastroenterology, finding one in Marshall, a young registrar eager to challenge conventional wisdom. Marshall and Warren faced significant challenges in isolating and culturing the fastidious organism. Initial attempts proved unsuccessful due to the bacterium's specific growth requirements. Eventually, a serendipitous event led to success. A forgotten petri dish left over a weekend incubation fostered the growth of the previously elusive bacteria. This breakthrough allowed them to characterize the organism, identifying it as a novel species they named Helicobacter pylori. Their subsequent research meticulously documented the presence of H. pylori in patients with gastritis and peptic ulcers. They proposed a radical hypothesis asserting that H. pylori infection was the primary cause of these diseases, a direct challenge to the entrenched acid stress model. Initial acceptance among the medical community proved difficult. The idea of a bacterium thriving in the high acidic environment of the stomach seemed improbable to many, defying established physiological principles. Furthermore, pharmaceutical companies, heavily invested in acid-suppressing drugs, demonstrated little enthusiasm for a discovery that threatened their lucrative market. To further demonstrate causality, Marshall famously ingested a culture of H. pylori himself. He developed gastritis, experiencing symptoms such as nausea, vomiting, and abdominal pain. Biopsies confirmed the presence of H. pylori and inflammation in his stomach lining. He then successfully treated himself with antibiotics, fulfilling Koch's postulates and providing compelling evidence for the bacterium's role in causing gastritis. This audacious act, while ethically questionable by modern standards, garnered significant attention and helped galvanize further research. The experiment was a bold move that remains a memorable illustration of scientific commitment. The formal publication of their findings in the early 1980s in journals, such as The Lancet, stimulated a wave of research. Studies around the world confirmed their observations, demonstrating the prevalence of H. pylori infection in patients with gastritis and peptic ulcers, and the efficacy of antibiotic treatment in eradicating the bacteria and healing ulcers. Meta-analyses of clinical trials provided overwhelming evidence supporting their hypothesis. The impact of Marshall and Warren's discovery on the treatment of peptic ulcer disease was profound. Antibiotic-based therapies, often in combination with acid suppressants, revolutionized patient care. Ulcers, once considered a chronic and debilitating condition, became readily curable in most cases. This led to a dramatic reduction in ulcer-related complications, such as bleeding, perforation, and gastric cancer. The burden of disease significantly diminished, improving the quality of life for millions worldwide. The shift from chronic symptom management to curative treatment marks a significant turning point in medical history. The legacy of Marshall and Warren's work extends beyond the treatment of peptic ulcer disease. H. pylori infection is increasingly recognized as a risk factor for gastric cancer, the third leading cause of cancer-related deaths worldwide. Eradication of H. pylori has been shown to reduce the risk of developing gastric cancer, offering a potential strategy for cancer prevention. Furthermore, research continues to explore the role of H. pylori in other gastrointestinal disorders and even in seemingly unrelated conditions, such as cardiovascular disease and neurodegenerative the influence of their discovery extends to epidemiology and microbiology. Researchers explored the transmission routes of H. pylori, its prevalence in different populations, and its genetic diversity. Understanding the bacterium's virulence factors and its interactions with the host immune system remains an active area of investigation. The study of H. pylori has provided valuable insights into bacterial pathogenesis and the complex interplay between microbes and their hosts. Critiques of Marshall and Warren's work were initially centered on the perceived improbability of bacterial survival in the stomach and the limitations of early diagnostic techniques. Some researchers questioned the specificity of H. pylori for causing ulcers, suggesting other factors might play a significant role. However, as evidence accumulated, these critiques gradually diminished. Refinements in diagnostic methods, such as urea breath tests and monoclonal antibody-based assays, improved the accuracy and reliability of H. pylori detection. Longitudinal studies demonstrated the causal link between H. pylori, infection, and ulcer development. The work of Marshall and Warren built upon earlier, often overlooked, observations. In the late 19th century, researchers such as Walery Jaworski had described spiral-shaped bacteria in gastric lavage fluid, a finding largely dismissed at the time. The development of endoscopy and gastric biopsy techniques in the mid-20th century provided the tools necessary for Warren to observe H. pylori in tissue samples. Marshall's expertise in gastroenterology and his willingness to challenge conventional wisdom proved crucial in translating Warren's observations into a testable hypothesis. The impact of Marshall and Warren's discovery on others is undeniable. Countless researchers and clinicians have built upon their work, refining diagnostic and treatment strategies, exploring the bacterium's pathogenesis, and investigating its role in other diseases. Their discovery spurred the development of new antibiotics and diagnostic tools. The collaborative efforts of scientists worldwide have deepened our understanding of H. pylori and its impact on human health. The 2005 Nobel Prize awarded to Marshall and Warren stands as a testament to the power of scientific curiosity, perseverance, and a willingness to challenge established dogma. Their discovery not only revolutionized the treatment of peptic ulcer disease but also transformed our understanding of bacterial pathogenesis and the complex interplay between microbes and human health. It serves as a reminder that even the most entrenched beliefs can be overturned by rigorous scientific investigation and a commitment to evidence-based medicine. Furthermore, the story illustrates the often winding path of scientific discovery, where serendipity and collaboration play crucial roles in advancing our knowledge. It is also a story of extraordinary fortitude, a triumph of careful observation, creative thinking, and experimental courage over entrenched scientific orthodoxy. Their unconventional approach, characterized by a willingness to self-experiment and challenge established norms, ultimately led to a paradigm-shifting gastroenterology and a significant improvement in global health outcomes. The impact of their discovery continues to resonate today, shaping research and clinical practice in the field of gastrointestinal medicine. It also proved an object lesson to the scientific community regarding the need to question assumptions and respect the value of careful observation.
We really appreciate you tuning into this AI-powered presentation. Our goal is to push the boundaries of AI in content creation, and your input is invaluable. If there's a particular subject you'd like to see us tackle next, or if you have suggestions on how we could fine-tune our AI's creative prompts, please don't hesitate to leave your ideas in the comments section. We're excited to bring you more unique content very soon.